Hey there VC HHD students, my name's Andy, I'm a VC Health and Human Development teacher. In this short video today we're going to look at what is a trend and what is a relationship in relation to graphs in VC HHD. This is often something that students find a little bit confusing, the difference between trends and relationships, so let's clear that up. So to look at what a trend is, I thought I would provide you with a graph that's been in the HHD exam in the past so that we can look at a couple of different examples of trends. So when considering trends, what you're often looking at is changes over periods of time or differences between groups. So if you were looking at this data here, which is looking at the life expectancy at birth for males and females in Australia, and you were asked an example of a trend, there's a couple of different things that you might say. So you might look at the data and say between 1890 and 2017, there was an increase in male life expectancy. And so that would be one example of a trend. Obviously, if the question also asked you to use data, you'd include some pieces of data in your answer. Another trend that's also present here is that females across 1890 to 2017 have always had a higher life expectancy at birth than males. So that's another example of a trend. So that's looking at the differences between groups. So what is the difference then in a relationship? And so what I typically say to my students is a relationship is a connection between two different factors, as the name suggests. And so when looking at graphs, it's typically easiest to look at what's happening along the x-axis and how is that influencing what's happening on the y-axis. So if you look on the x-axis here and you look at the socioeconomic status, it's going from lowest at the left to highest at the right. And that then is connected to the number of people per 1,000 admitted to hospital. And so a relationship is a connection between these two factors. So for example, a relationship in this graph would be as you move from lowest socioeconomic status to highest socioeconomic status, there's a decrease in the number of people per 1,000 that are admitted to public hospitals. But also another relationship is as you move from lowest socioeconomic status to highest socioeconomic status, there's an increase in the number of people admitted to hospital per 1,000 for private hospitals. So there's a couple of different examples of relationships in this graph here. So as I mentioned at the beginning, a relationship is a connection between two factors that's easiest typically to look at what's happening along the x-axis and connect that to what's happening on the y-axis. And so relationship questions often come up when looking at the population groups in Australia, such as socioeconomic status and those living within and outside major cities. And that's typically because there's a graded connection between moving from low to high SES and moving from within to outside major cities to various factors. So that's just something to keep in mind if you ever see data about those population groups. Is it a relationship that you're looking at? Hopefully you found that video useful. If you're after more tips and advice every day between now and the HHD exam at the end of the year, I'll be putting out a video each day, so please subscribe to the Health Resources Hub YouTube channel. There's a subscribe button in the bottom corner of this video. I'm also doing an ACE HHD exam preparation and revision lecture at the end of the year, so you can book a spot for that at book.acevc.com. And you can also follow us on Instagram and Facebook, or if you've got any ideas of videos that you'd like to see between now and the end of the year, feel free to send us an email at info@thehrh.net.au. Thanks so much.